So how many ophthalmologists really are considering, what is the trend saying, considering private equity?
Well, there is a definite uptick in the number of practices who have engaged with private equity or sold or become partners with that. The numbers are increasing dramatically. How many people actually are thinking about it and considering it? Of course, we don't know, but it's a hot topic. So everybody wants to know a little bit, wants to know if they're missing out. And the number one question I think people have is this something that's going to stay with us, or is this kind of a flash in the pan that's going to come and go as it did, previously a few decades ago?
Mm-hmm. What are some of the major roadblocks that are prohibiting doctors from considering private equity then?
Well, I would say really the risks or the concerns that people have are really very similar. One is the loss of autonomy. Who do you want to work for? Do you want to work for a private equity firm? And I think the most important one that people talk about is wanting to be able to preserve their culture and their core values. So people who've built a practice have built something that they're very, very invested in, they're very proud of. They've created a culture. They've had employees that have worked there for, decades and care about them, and they want to be sure that they can maintain that culture. And also, most importantly, that the focus can remain on quality patient care and not necessarily on turning a quarterly profit.
So where do you think we would be a year from now, say, with the numbers of doctors that are still considering it, or do you think anything will change?
I think private equity will continue to be a part of our landscape, and there will be people who find those partnerships valuable. I think there are a lot of other groups that are looking at other strategies for growth and different things they can do to remain independent. So I think we'll have both.
Okay.